Every year, people in San Antonio make thousands of mental health calls to 911.
This week in our series, Crisis in Question, Measuring San Antonio's Mental Health Solution, we're seeing how effective San Antonio's program is at addressing the growing mental health crisis that's happening across our country. And in this series, we're showing you how our city's mental health response program stacks up to others in the United States.
But tonight, we get to the why. Our Avery Everett is going to show us why these programs are being pushed across the nation.
A rush of feelings.
And there's a lot of fear and anxiety.
All in a matter of minutes.
The worst day you've ever had in your life, and times it by 1,000,000.
With ups and downs, finding stability is no easy feat.
Clearly, there's a mental health crisis in America.
And that's why the city of San Antonio is searching for a solution.
It's not going to go away.
Statistics show 1 in 5 adults living in the U.S. have a mental illness. And in San Antonio, that roughly means 250,000 people.
This has been going on for decades.
Call logs show last year the San Antonio Police Department received more than 32,000 mental health calls to 911, and the city expects that number to climb.
We need to apply innovation and expertise to address it.
So how do cities like San Antonio respond to a mental health crisis? And are their solutions working effectively? This is the question we're exploring this week in this series. And it all starts with understanding what happens during a mental health emergency.
We are dealing with very complex individuals.
These moments of crisis can look different for every person. But mood swings, flashbacks, and risk of harm are all common.
You just feel no hope.
These calls are very fluid and they can change over time.
But if untreated, mental health can manifest in other ways. And San Antonio Mayor Ron Nirenberg says our city regularly sees those delayed effects.
We have seen a sharp rise in mental health challenges, rising and manifesting in homelessness and substance abuse.
And it gives a brief of what the problem is, of what the...
That's why the city created a crisis response program called SA Core.
They took her to the hospital
To specifically respond to mental health 911 calls with a team of resources.
We want this to be a tool.
The city says its goal is to get people the help they need before a crisis evolves. And this team is strategically strung together.
Uniform kind of dressed down.
With a police officer.
So we do carry Versed.
Paramedic.
I love working with them.
And crisis response clinician.
We're doing everything we can and continuing to learn how we can address this issue better.
Her date of birth?
As this team tries to expand, mental health experts say it's time to take a closer look.
And we have a gap in our community of care for people who are seriously ill.
We need to figure out what works best for our community and look at how that 911 system might evolve.
To see what works in our mental health response system and see what may need to change.
Well, safety can no longer be the absence of crime. It has to be the presence of well-being.
Because life can take an unexpected turn at any time.
It's always a series of events.
And addressing mental health is a constant uphill battle. There's no one-size-fits-all model to creating a crisis response team. That's why tomorrow night we're showing you the most common types of these programs. We'll show you where San Antonio's unit stacks up and take you behind the decision that city leaders made in choosing a program that involves police. Avery Everett, KSAT 12 News.
Does San Antonio have the right solution for responding to mental health crisis? That's the question we're taking a closer look at all this week in our series Crisis in Question, Measuring San Antonio's Mental Health Solution.
So we know that 1 in 5 adults in the U.S. has a mental health illness. And in San Antonio, that breaks down to 250,000 people. And that's why the city created its emergency response team, which many of you know as SA Core. The night team's Avery Everett shows us how it works and also why some people have issues with it.
This nation has been trained, when in trouble, dial 911.
In a moment of crisis, there's no telling what's on the other end of that line.
These calls are very fluid and they can change over time.
It could be a shooting, a fire, or even a fall. But more and more, these calls are mental health emergencies.
There's no finish line to this.
When dialing 911, a person is usually met with 3 options. Police, fire, and EMS. But mental health advocates argue that might not be enough.
There's room for growth.
It's evolving.
We could do a much better job in our community with coverage and answering calls.
The San Antonio Police Department saw nearly 11,000 more 911 calls from 2019 to 2023.
So this would be the paramedic vehicle.
To better respond to these mental health cases,
I see one that's tagged as mental health in progress.
cities have created crisis intervention teams. These are typically multidisciplinary programs made up of law enforcement, health officials, and crisis response clinicians to bring the best resources to someone in need.
It truly is the present.
There are two models cities usually choose between: a co-responder team or a community civilian response team.
They both have a very similar mission, but they also are different in the way that they are comprised.
San Antonio's mental health crisis response team is called SA Corps, and it's classified as a co-responder unit. That means when they respond to a 911 mental health call, there's a paramedic, a law enforcement officer, and a mental health professional.
So what's going on today?
Experts say this system can improve public safety and make services more accessible, while keeping a scene safe with that officer.
It's cost effective, they have great outcomes, and they all have attachment to case management.
But having police in these programs is often a point of criticism.
Sometimes that officer showing up can be a barrier to communication, to building rapport, and trying to really connect a person with empathy.
Hello.
That's the main difference between a co-responder and a community civilian response team. A community response model focuses on dispatching a team of behavioral health professionals instead of those officers. If a situation does escalate, this team would have to call in law enforcement. But typically, reduced costs, improved access to treatment, and culturally responsive interventions are all common with this model.
It is cheaper, they provide an excellent service, and they mitigate a lot of the calls that come into 911.
So we're going to self-assign.
There's no one-size-fits-all program.
We need an all-of-the-above strategy. I don't want to pick a winner or a loser.
Or blankets.
But as SA Corps looks to expand, mental health experts say lessons can be learned.
I think San Antonio has a good program, but I do think there's room for improvement.
Because the phone is going to keep on ringing. And meeting our community with the right resources all comes down to city response.
So what mental health crisis response team should a city choose, and who gets to make that decision? That's what we're exploring the rest of this week. In our own city, we get to see that co-responder model, but seeing a community response team requires a bit more travel. So we planned a trip. So we came to Denver to see how they do it.
Filling a gap that's long been forgotten. That's how mental health advocates describe the need for crisis response teams across our country.
In our series this week called Crisis in Question, Measuring San Antonio's Mental Health Solution, we're comparing response models between different cities to see how effective they really are. Over the past 2 days, we told you about growing mental health concerns in the United States. We showed you the two most common types of city response systems. The first one is a co-responder team where police work with mental health clinicians and a paramedic.
So the second is a community response model. That's when a mental health clinician works with a paramedic, but no police officer. San Antonio, though, does not use that model in particular. Now, tonight, our story is going to take us to Denver, Colorado, where the other system is in place.
The night team's Avery Everett spent a day following their STAR team to see where San Antonio measures up on a nationwide scale.
We've been pretty limitless in what we can do with people.
You can get people to the right places.
We're giving people hope.
This isn't the San Antonio skyline, but one story here in Denver, Colorado hits closer to home for us Texans. Mental health response.
This is the gap in the system that needs to be filled.
With a problem that's persistent across the country, there's no one-size-fits-all solution to address mental health in every city.
What we really want is to be able to support the community in the best way that makes sense.
To the city of Denver, that's the STAR program.
So this is our STAR vans.
STAR stands for Support Team Assisted Response, and it's a community response model. That means it pairs up a behavioral health clinician and a paramedic to respond to certain 911 mental health calls. There is no police officer on this team.
People should know that when they call in a crisis, they're going to get the help that they need and that they deserve.
We're there trying to change the systems that have failed people over the years.
When a call comes into 911, the STAR team checks to see if they're qualified to cover it.
We're constantly evaluating and reevaluating the situation.
And if a STAR team is assigned, it's not long before this unit is out on the road.
We want to take that stigma away from the kind of calls that we run.
Giving the right resources is the mission of STAR, and that's why this team has customized its vans.
Everything is labeled for quick access. A lot of times the crisis isn't just about the mental health emotions that are going into it. It's I haven't showered in a week, I don't feel good, I need sunscreen, I'm getting sunburned out here, just things like that that we can easily solve.
This is very specialized to Denver's population.
Absolutely. I think the best way to serve people is to know your community.
If a situation escalates, this team calls in law enforcement. But the Denver Police Department says most cases are handled independently by STAR.
These are the right people. They're going to support you.
Well, we've got snacks in here.
This program is supported by multiple groups. WellPower provides the clinicians, Denver Health staffs the paramedics, and Servicios de la Raza provides culturally responsive wraparound services.
Why is it so integral to have continued follow-ups?
So that you're not putting just a Band-Aid on something that really their needs can be met of longer term.
What makes this program so important in a city like Denver?
I think there's just such a need.
We could always use more funding and more vans on the street and more people to serve the communities.
Denver has yet to make the STAR program 24/7. Funding, staffing, and making sure other resources across the city are available during these extended hours is currently holding back an expansion.
And then we have clothing for people.
But the goal is to bring this team to 24/7 by 2025.
You can de-escalate someone, but if you don't change the environment, they're still going to be in that environment that caused them to get to that level of distress in the first place.
STAR's response rate last year was just under 50% of eligible calls.
STAR runs into where society is failing.
Well, there are lessons that can be learned from places like Denver to get a better response for people who are dealing with a mental health issue.
Mental health advocates here in San Antonio were part of the reason why we decided to go to Denver. They told us that San Antonio and Denver had a similar amount of mental health calls, but they also told us that their programs to respond were vastly different. Tomorrow night, we're bringing things back home to here in San Antonio, and we're riding along with the SA Corps team to show you their program. And we're asking city leaders why police officers were integral to our SA Corps system. Avery Everett, KSAT 12 News.
Police officers were never equipped to deal with mental health calls. We are not the experts.
Tonight, a closer look at the team that San Antonio created specifically to respond to mental health crises. It's called SA Corps. The unit is made up of a police officer, a paramedic, and also a mental health clinician.
Yeah, the goal is to address the gap that San Antonio Police Chief William McManus just talked about, to get the right people with the right resources to respond to these crisis situations. In our series this week, Crisis in Question, Measuring San Antonio's Mental Health Solution, we're asking how effective San Antonio's team is at addressing the growing needs of our community.
Over the last 3 days, we've shown you the staggering data, also explained the different types of responses, and even took you to Denver, Colorado, which has a very different system from the one that we have set up right here.
Tonight, the night team's Avery Everett brings us back home, where we'll see our own system in action.
But just a warning that first, this story is about someone's personal struggle with suicidal thoughts.
I have attempted suicide I don't know how many times in my life.
What do you think brought on these thoughts?
I have no idea. I have been depressed most of my life.
A hard conversation to hear. But it's one the SA Corps team has had thousands of times.
I've seen a lot of hopelessness.
We're here to stay, and we're here to make a difference.
SA Corps stands for San Antonio Community Outreach and Resiliency Effort.
Her date of birth?
This is the city's main team tasked to respond to mental health 911 calls.
It's a game changer.
Some aspects are not always criminal.
Each unit here is made up of 3 people. A San Antonio Police mental health officer.
We do have Narcan with
a San Antonio Fire Department paramedic.
It's growing because...
And a Center for Healthcare Services crisis response clinician.
Thank you.
Over the last 2 years, this team has completely transformed. Going from a single unit covering the downtown area to now 3 teams scattered across the city, all with 24/7 staffing.
It's making a difference in people's lives and probably saving lives in the process.
Every day and every case doesn't look quite the same for SA Corps. That's why we asked to ride along with them for one shift, to see what's working and to see where there's room for growth.
We're able to do it all here in this little mobile team.
As the day begins, this team packs and prepares.
So we offer a snack, we offer water, and now we're actually treating and healing.
Until the first call comes in.
I see one that's tagged as mental health in progress.
SA Corps can self-assign to calls they discuss and decide are a good fit.
These are our blankets.
They look at history and what's actively happening, avoiding calls with weapons or violence. And once they've all agreed, it's not long before they're out on the road.
We're a city over 1 million population, and you have 3 teams. You know, you could do the math on that. It's a lot of work.
Right now, the San Antonio Police Department says SA Corps responds to about 14% of the total mental health calls coming into 911. It's a statistic the department says it's working to improve.
Hi.
I got the officers here.
What's going on today?
Well,
this call came in as a person with suicidal ideation. That means they've been preoccupied with thoughts of suicide.
Can I check your blood pressure?
Sure.
After an introduction and a conversation, SA Corps learned this person was struggling with their future housing.
Do you feel like that is like a primary stressor of the situation?
Oh, yes, definitely.
After about an hour and after a full assessment, SA Corps decided an emergency detention was the best option. The unit transported this person to a hospital for further evaluation and care. This job is not something SA Corps takes lightly, but it is something the team says the city desperately needs.
These are humans, human beings, and they suffer.
But is the staffing right for this type of response? That's the question mental health advocates bring to the table.
Sometimes that officer showing up can be a barrier to communication.
So we asked top city leaders why police are a part of San Antonio's equation.
We didn't want to send people to a call where there could be violent behavior and possibly stand a chance that they might get hurt.
An officer needs to be there for site security.
Let's do what we know will work according to the experts in the room, but also let's use some common sense.
An acknowledgement of the need for the right response.
Police officers were never equipped to deal with mental health calls.
But one the city says it's confident can be done through SA Corps.
In fiscal year 2025, the city says SA Corps is expected to respond to more than 4,000 calls. So the question is, as the city looks to expand this program, how are they going to do it? Tomorrow night, in our final story of a crisis in question, we're taking a look at how the city is pushing longevity, but also keeping the community safety in mind. Avery Everett, KSAT 12 News.
Faced with a crisis, San Antonio is searching for a solution to respond. Statistics show that 1 in 5 adults living in the U.S. has a mental illness. So when you do those numbers, you crunch them. In San Antonio, that comes out to about 250,000 people. This week, in our series Crisis in Question, measuring San Antonio's mental health solution, we've been evaluating just how effective the SA Corps team actually is. SA Corps is the city's crisis response unit that answers mental health 911 calls. Right now, the San Antonio Police Department says that SA Corps responds to about 14% of the total mental health calls that come into 911 in our area. Now, that number is something that the department says it's working to improve. Leaders, on the other hand, say that number still shows success. Now, 2 years after that program was created, the city is working to continue its expansion. But where do they go next? The Night Team's Avery Everett answers that very question tonight.
In the 7th largest U.S. city, life passes by pretty quickly. But in a mental health crisis, time can stand still.
The worst day you've ever had in your life, and times it by 1 million.
That's why the city of San Antonio says SA Corps is its future.
It's not like what it was before, just putting a Band-Aid. So now we're actually treating and healing.
SA Corps is the team tasked to respond to 911 calls coming in for mental health emergencies.
Before, 2 weeks ago.
Each unit is staffed with a police officer, a paramedic, and a mental health clinician. Over the last 2 years, this team has responded to more than 5,000 calls. But in that same period of time, the city has had more than 60,000 come in.
Clearly, there's a mental health crisis in America.
I guess you could say.
SA Corps started as a single unit covering the downtown area.
Decided to take it, so we're going to self-assign.
Now, 3 teams cover the entire city, and they're all staffed around the clock.
Where do you see the most room for growth within SA Corps?
We definitely need more teams.
Funding is a nationwide problem. Here in San Antonio, for the fiscal year 2025 budget, the city covered the current cost of the SA Corps team, and that unit is expected to answer more than 4,000 calls over the next year. But that budget didn't include any expansions for the unit.
We're going to budget accordingly. It's not necessarily that the dollars might go up.
Hello. But that doesn't mean SA Corps won't get additional dollars.
There is federal funding available.
And that doesn't mean more services won't streamline SA Corps services.
We will continue to evolve as we see better ways of doing it, better ways of tweaking it.
Innovation is the city's priority as this team looks to expand. Mental health advocates say technology and outside tools could spark some creativity.
But what we need to do is learn along the way of how to make a better response and how to better utilize our resources.
I think collaborating with 988.
We need to really look closely and see how telehealth might support some of the work that we're doing in the field in a dynamic environment.
In the long run, some say a team without police could support San Antonio in a new way.
Sometimes that officer showing up can be a barrier to communication. Why wouldn't San Antonio engage in this kind of response to add another level of care?
You have to be willing to try it.
Do you think that's a fair ask?
I do. Absolutely, I do. But we would have to really figure it out and make sure that it's safe. But I do think that there's a possibility that that could come to fruition.
As our population in San Antonio soars, finding the right solution to addressing the mental health crisis is a citywide priority.
The big barrier for communities is stigma.
Well, safety can no longer be the absence of crime. It has to be the presence of well-being.
I want to emphasize that SA Corps is the city's main crisis response unit for handling 911 calls. But the San Antonio Police Department and the Center for Healthcare Services also have other mental health teams dedicated to help people in need in our community. On Ksat.com, we have all the stories that we've shown you this week and also a list of resources to help provide you with more details about this program. This is far from the last conversation that we'll have here at KSAT 12 about mental health. But we hope this series gave you insight into what happens when you call 911 during a mental health emergency. Avery Everett, KSAT 12 News.